In less than a decade, the nonpartisan Congressional Budget Office predicts the number of people in the U.S. without insurance will increase by 10 million because of the passage of the Big Beautiful Bill.
Joining your sides, Kelly Dudzik is here now with some analysis from an economics professor to let us know what this actually means for health care. Kelly?
Well, Scott and Claudine, changes to Medicaid were signed into law by President Donald Trump this summer as part of this bill, and most don't go into effect right away.
Last week, Kaleida Health announced 31 employees are expected to lose their jobs when 2 therapy clinics close this November. Kaleida says the decision comes as Medicaid funding is expected to drop under the Trump administration's Big Beautiful Bill. This morning, Republican Congressman Nick Langworthy told us Kaleida made a business decision and blamed the bill, even though he says Medicaid payments won't change for several years.
I feel for anyone that loses their job, but they clearly felt that those clinics weren't beneficial financially for Kaleida, and they made a business decision. Now, they can blame the Big Beautiful Bill, but there's been zero impact of the Big Beautiful Bill in terms of dollars and cents. There has not been one dime that has changed. It won't to New York for many years.
This afternoon, I went to UB North to talk with an assistant professor of economics about how this law will impact healthcare. He says take everything with a grain of salt.
Most of it doesn't even go into effect for a couple of years. Some of it actually several years, right? And so, I would be sort of skeptical that the newly signed bill is having real immediate impacts. I think there could be some negative impact on healthcare, but it may not be as large as you would expect because you have that work incentive as well.
Barkowski also thinks people with higher paying jobs in healthcare, like doctors and nurses, should be okay.
Maybe some of the other types of jobs associated with healthcare, like, the back office type jobs, or maybe like lower level patient service jobs might have some risk.
I did reach out to Kaleida this afternoon for further comment to see if there could be additional immediate impacts, and a spokesperson told me they're working on a response. On your side, Kelly Dudzik, Channel 2 News.